chronic migraine is a real disorder and fairly common. In fact, the Migraine Research Foundation calls it an extraordinarily prevalent neurological disease, affecting 39 million Americans but arises 3 times more often in younger women, ages 18 to 44 years, than in men. If these statistics aren't enough to bring on a headache, then prepare yourself for findings from a report published in the journal Cephalalgia, which adds further evidence that having an endocrine-related condition is likely to increase your risk of migraine headaches. Endocrine disorders may worsen migraines, or vice versa. The data uncovered by this researcher team suggests that migraine headaches seem to occur more often in individuals who also have other conditions like thyroid disease, insulin resistance, obesity, and high blood pressure. 3 Don't despair. The research sheds light on what might be driving these connections and offers a good understanding as to the steps to take to reduce your risk of having these intense headaches as well as improve your overall health and quality of life. And the good news is that by having these clearer insights into the interrelationship of migraine with numerous possible coexisting health conditions, you're more likely to gain better treatment, particularly more effective migraine reduction or relief, say the researchers at the University of Torino, Italy, who reviewed the literature on comorbidities between migraine and different metabolic and endocrine disorders. Should you be worried you'll develop migraines? While numerous studies support a link between chronic migraine and various metabolic and endocrine disorders, there is still a ways to go before anyone will be ready to declare that having an endocrine-related condition means that you may develop migraine headaches, too. The mechanisms driving these conditions remain largely under study, the researchers say. Yet, much of the ongoing research points in the direction of supporting the role of insulin regulation in modulating brain functions such as metabolism and clear thinking skills, cognitive function. Endocrine Web spoke with 2 headache specialists to review the new report and offer some advice for anyone under care for an endocrine disorder. The associations between migraine and other health issues do not come as a surprise to Gloria Sims, MD, a neurologist and headache specialist at Valley Baptist Medical Center and attending physician at the University of Texas at Rio Grande Valley. Yet, this latest review definitely strengthens the evidence that insulin resistance is a factor in the onset of migraine, Dr. Sims says. While we know that migraine has many factors that are likely to play into its development, we don't fully understand it, she says. What should patients expect? Dr. Sims says anyone who has experienced migraine or intense headaches should ask your primary care physician about checking you for insulin resistance. If your doctor tells you that you have nothing to worry about, she suggests asking your health provider to monitor you and treat as needed, as it might just improve your migraines. Action steps to help you manage migraine risk based on the research overview. What can you do if you are having migraines? Dr. Sims and Dr. Peterlin suggest stepping up your attention to your medical care by seeing your healthcare provider at least once a year, and more often if your symptoms are not well controlled. Talk to your doctor about ruling out any of these associated endocrine-related conditions, and whether treating any irregularities more aggressively may help reduce the number and frequency of your migraines. Take seriously any suggestions your doctor raises regarding diet, exercise, blood pressure control, and keeping your blood sugar at a steady level. You might even ask for a referral to a dietitian or certified diabetes specialist who can help you identify specific steps you can take to improve your health. While not new or news to you, the researchers reinforce the importance of increasing your physical activity, achieving weight loss as needed, and reducing any cardiovascular risk factors such as high blood pressure is advisable for many reasons, including helping to prevent and lessen migraine symptoms. Thank you for watching.